Welcome to Accommodate This. My name is David, and I'm a late diagnosed autistic adult. I have an interesting topic for you today. Today, we are going to discuss stigma, more specifically, stigma related to autism. And we have a lot of information to cover, so let's get into it. Stigma is when people have negative beliefs about someone because of who they are or their situation. This includes things like ignorance, prejudice, and discrimination. Stigmatization affects a person's health, employment, educational attainment, and more. Basically, people with disabilities are facing challenges that are not only because we are different, but also because of barriers in society, negative attitudes, and a lack of support. Increasing knowledge of autism has been shown to reduce stigma, and we see a global effort to raise autism awareness, and this has been happening for the last several years. All of this is meant to address the issue of stigma. But unfortunately, efforts to reduce stigma have faced challenges because stigmatization serves multiple evolutionary, psychological, and social functions. For example, stigmas about illnesses help us to avoid pathogens. Stigmas about change motivate us to maintain the status quo. And stigmas about weakness contribute to exploitation and dominance for political and economic gains. And while the general amount of stigma in society has remained rather level over time, minor changes do occur. For example, studies show that stigmas pertaining to socio-demographic identities, such as race, religion, or ethnicity, change more than body-related identities, like physical appearance, weight, or disability. And it makes logical sense that if the underlying motivations to stigmatize have not been addressed, advantaged groups will continually reproduce stigma by developing new means to stigmatize the same groups via interchangeable, mutually reinforcing mechanisms. Whew, that was a lot of words. But basically, studies show that people with an intellectual or developmental disability, IDDs, experience stigma in early childhood, and stigma increases with age. Research found that people are more likely to socially distance themselves from individuals with an IDD than they are of an individual with a physical disability. Stigmas are perpetuated through limited exposure to individuals with a disability, so people's natural inclination to stay away from disability only makes it worse. In anticipation of or in response to experiences of stigma, individuals with IDDs strategically use concealment to compensate for or hide traits associated with our disability, which that makes stigma even worse. And studies have found that camouflaging or masking is more common among those who experience more stigma. Over time, camouflaging not only creates a considerable stress and fatigue and exacerbates chronic stress, but it also contributes to the stigma because it distances the rest of the population from the disability. This is a problem. The more we hide, the less people are going to understand us, and the more they're going to build on the stigmas against us. And this has been happening for so long that the general population barely knows anything about autism. We are surrounded by ignorance, which is bad on its own, but because of the stigma attached to it, people are less likely to seek out information to educate themselves on the topic of autism. They're less likely to give empathy a chance. They are more likely to be judgmental and cold toward autistic individuals. They are less likely to extend grace and forgiveness of social faux pas and more likely to shun and label us as rude. The Autism Stigma and Knowledge Questionnaire, also known as AskQ, was developed by scientists to identify various levels of autism knowledge and stigma across multiple cultures. One study using this questionnaire compiled data from 6,830 participants administered in 13 different countries across 4 different continents. And they found that knowledge of autism was highest among family members, but significantly lacking among teachers and medical practitioners across the globe. So much progress can be made by addressing the lack of knowledge in those two professions. Stigma broadly contributes to chronic stress and maladaptive coping behaviors and impedes service access and utilization. In addition, individuals with IDDs experience distinct health impediments due to variability in how our disabilities are perceived and discernible to the general public, which makes stigma particularly potent for those of us with IDDs. In fact, studies show that individuals whose IDDs are easier to conceal from the public have just as many, if not more, health challenges. For example, they report greater social isolation and less social support relative to individuals with more visible conditions. These factors have profound impacts on psychological and physical health. Stigma associated with high-functioning autism, for instance, may be worse than that associated with more visible conditions because individuals with high-functioning autism are more likely to be blamed or personally attacked for divergent behaviors. Thus, all individuals with IDDs, not only those with the highest support needs, experience poor health outcomes due to stigma. Exacerbating issues of visibility, the fear of being labeled may cause individuals to delay or avoid seeking treatment altogether. Stigma not only results in less utilization of assistive services, it also discourages us from seeking those services in the first place. This is particularly detrimental for the IDD population, given our distinct service needs. Thus, the health effects of stigma are uniquely and profoundly experienced among individuals with IDDs. It's easy to take these things lightly, but that would be a mistake. I used the word profound because it is the correct terminology to use. After all, stigma around autism and autistic people puts a lot of stress on our mental health. In fact, autistic people are 4 times more likely to experience depression than non-autistic people. And suicide is the leading cause of death among autistic individuals. We also usually have a shorter life expectancy, mainly because of the poor quality of life caused by societal expectations and a lack of understanding. Research on stigma from the autistic perspective is not studied enough, often focusing on the experiences of those around autistic people rather than the autistic people themselves. Even charities like Autism Speaks have sometimes added to the stigma by focusing on the burden and tragedy of having an autistic child. A recent review of 300 randomized clinical trials published in high-impact medical journals found that people with IDDs were represented in only 2% of those trials and could have been included in others with minor methodological tweaks. Many autistic people now support the idea of nothing about us without us, meaning we should be involved in decisions affecting our lives. Neurotypical assumptions based on their experiences are harmful to autistic people because of our fundamental differences. It's unfair to judge autistic people by neurotypical standards when we don't fit that mold. And this brings me to a phenomenon known as stigma power. Stigma power is the level of effectiveness behind any stigma. So for example, exploitation and domination through wealth, power, and social status has the capacity to keep people down. Enforcing social norms through written and unwritten rules that regulate everything keeps people distinctively in or out of favorable groups. And avoiding disease by avoiding those who have an unhealthy appearance is a powerful motivator to keep people away. And the stigma power is significant because it provides justification for perpetuating the stigma. Those who benefit from holding on to the stigma are likely to be our biggest opponents in our effort to eliminate it. Unfortunately, when experts attempt to implement interventions to address stigma, much of the time the focus is on enhancing the coping strategies of stigmatized individuals than it is on increasing empathy and shifting understanding. But this simply places more of the burden on the stigmatized population. Most of the stigma around autism is based on social interactions, which involve more than one person. And despite there being a lack of autism knowledge, it's widely understood that autistic people have social difficulties. But many of these difficulties are not purely based on social deficits. Many of these difficulties stem from our autistic behaviors and how others perceive them. First impressions of autistic people are often negative, and studies show that these judgments happen quickly, last a long time, and affect both children and adults. So it's not so much about our own behaviors as it is about the reactions of those we are interacting with. And interestingly, researchers have found that biases are less common in conversations that are not face-to-face. And this suggests that how we communicate, not what we say, drives negative impressions of autism. This is important because autistic people show social behaviors differently from non-autistic people, like facial expressions, eye contact, timing of gestures, personal space, and the way we speak. These differences can be seen as awkward or offensive, affecting social interactions and making people avoid future interactions. They also reported that people are more likely to worry that the individual with the IDD might become aggressive, contributing to lower acceptance, higher perceived danger, and other negative perspectives. It's been known for a long time that autistic people have trouble understanding the thoughts of non-autistic people. But recent studies show that non-autistic people also have trouble understanding the thoughts of autistic people. This is called the double empathy problem. These findings suggest that we need to look at autism's social difficulties from both sides, the individual's challenges and the biases of others. Autistic people make up only 1 to 3% of the world's population, so we are a small minority. Our differences are often seen as a challenge to societal norms, and we are expected to conform, which is unfair given our differences, our different instincts, different abilities, and so on. We often have to work harder to fit in during social interactions than anyone else, and we benefit from it less. This has to change. Remember, it will take both autistic and non-autistic people working together to eliminate stigma around autism. It takes two to tango. We can't do it alone. But with some understanding and acceptance and a bit of effort to look beneath the surface before judging, we can improve how we all communicate with each other. Now keep an eye out for my next video as we unpack 10 common myths contributing to autistic stigma. Until then, thank you for watching. If you enjoyed this video, please comment, like, and subscribe to see more content like this, or click on the video here to continue watching.